Herniated discs. How to avoid surgery. Did you know that most people over 26 years old already have herniated discs in their spine? The risk is that 68% of them do not present any symptom. However, the lack of treatment in time can ruin the intervertebral disc, which as a consequence will cause severe pain that leads to surgery, or in the worst case, to a partial paralysis of the joints that can lead the person to be incapacitated and to live with constant pains. This is why it is important to start the treatment as quickly as possible. Pills can temporarily block pain, but disc deterioration continues to worsen. How can a hernia be corrected to avoid surgery? Normally, there are very few options to correct this condition, since the muscular spasms it causes are deep in the spine, and it is really difficult to reach this area. In this video, we will tell you about some accessible and effective options for relieving and correcting herniated discs. Self-gravitation method. An integral therapy using the Cordus and Sacrum devices designed by Russian doctors to eliminate the spasms of the deeper paravertebral muscles and facilitate the regeneration of intervertebral discs. It is a simple method that can be applied in your own home. Cordus has 3 different sides for each area of the spine: cervical, dorsal coccyx, and lumbar sacrum, which is the area with the highest risk of herniated discs. It is placed on a flat surface so that the user can lie on it in a way that the axis of the spine sets between its tips. Thanks to the body's own weight, Cordus exerts constant pressure, and while breathing, the tips of the device penetrate to the deepest muscles of the vertebral system. After the first 3 or 4 minutes of pressure, these muscles relax. In this way, each vertebra of the damaged area is treated. There are other methods that try to decompress the lumbar zone, such as the case of inversion tables and traction beds, where the spine is stretched by the body's own weight or by a mechanism. These methods have disadvantages, since they start by stretching the weakest muscles, while the deepest areas, which accumulate great tension, are not treated in their entirety, needing a large number of sessions to see results. Cordus works the intervertebral zone precisely, symmetrically, and deeply.
For a greater therapeutic effect, it has neodymium magnets.
With a clinically proven design, Cordus tips penetrate deeper. It manages to self-accommodate just between the vertebrae. And with constant pressure, the tips relax and stretch the deepest muscles of the spine. This allows to increase the space between the vertebrae and restore their mobility. The oppressed nerves are released and the tissues of the intervertebral discs recover their good blood circulation, receiving necessary nutrients for their regeneration and also reducing the herniated discs.
Let's remember that this patient has a hernia of 8 millimeters, so that allows me to work directly in that area. But if this patient had a hernia bigger than 1 centimeter, then I would work 3 centimeters above or 3 centimeters below. And to the extent that the hernia is reduced, I'm going to be able to work directly in the area.
Contraindication for use: a broken fibrous ring. Why are herniated discs more common in the lower back? One of the main reasons for the occurrence of hernias in the lumbar area is the deviated position of the sacrum, caused by falls in childhood and a sedentary lifestyle. Because of this, it is very important as part of the integral therapy to eliminate the asymmetry of the sacrum area. This correction is made with the Sacrum device, which has a clinically proven shape to relax deep muscles and ligaments of this area.
To enhance the therapeutic effect, it has neodymium magnets.
For specialists, correcting the sacrum is a difficult task, since it is a bone surrounded by several layers of ligament and strong muscles. Normally, it requires long treatments and great medical skills to correct it.
I like to work with Sacrum during the first sessions, because remember that Sacrum is fundamentally related to the specific changes in the sacrum, and above all, it will serve to eliminate the blockages and nutation and contranutation problems that the sacrum has.
Another important part of the Cordus and Sacrum integral method are the exercises to recover muscle tone. It is also helpful that the person complements the treatment of the herniated disc with supplements to improve the cartilage, such as glucosamine and chondroitin or others. Not to be confused with pills that block pain. And obviously the person must correct some bad habits that may worsen the problem, such as incorrect sitting posture, bad sleep habits, stress, gym overloads, and others. Cordus and Sacrum are easy to use. They include a very detailed manual with photographs so that anyone can learn how to use them at home without difficulties or discomfort. Although the devices are made of rigid material, they can be used by anyone, since you control the amount of pressure exerted. If you prefer it, you can place a soft towel or some kind of support to reduce the pressure. You can also use Cordus on a mattress or an armchair. Although Cordus and Sacrum can be used separately in a very effective way, when applied together, the therapeutic effect increases up to 40 to 50%. Take care of your health.
More information at cordus.com.